Hello everyone, this is Amir, Hematology Registrar. Welcome back in the Hematology Bleeps. Our today's topic is high ferritin level. We usually receive calls from other teams that this patient has high ferritin level. Is there any hematological cause for that? Or this patient has infection plus high ferritin. Is there any possibility of HLH in this patient? So first of all, ferritin is an inflammatory marker. You will see that this ferritin will be high in infection cases or in the inflammation cases, any liver injury, kidney injury. This ferritin will be high because it is an inflammatory marker. So whenever you have any infection or inflammation, the ferritin level will be high. This does not mean that high ferritin has any hematological cause or if the patient has any HLH. For the hematological cause, the patient will have any background, or for HLH, it has its own features. So, causes of high ferritin can be non-hematological and can be hematological. So, the common non-hematological causes for high ferritin is or any infection. It can be sore throat, it can be chest infection, it can be urinary tract infection. When you check their ferritin level, it will be high. Not very high, it will be less than 1000, maybe 300, 400, like that, but it will not be very high that would cause any concern to you. If you have any inflammatory disease, for example, any autoimmune diseases, rheumatoid arthritis, ulcerative colitis, celiac diseases, etc., and you have acute flare-up, their ferritin count will high, but it will not cross 1000 usually. It will be less than 1000. Similarly, if someone has a liver injury, liver disease, it can be alcohol related, it can be without alcohol involved. But if there is any liver disease, their ferritin count will be high. Again, it will not cross ferritin, but if it crosses ferritin, then discuss with hematology why this patient ferritin is high. Does it need any involvement from hematology side or from liver side or not? Because this knowledge is a bit more for you as a non-hematologist. Similarly, if someone has chronic kidney disease, their ferritin level is a bit on higher side than normal. In hematology, there are two broad categories where the ferritin is usually high. One, I would say, is non you can say non-urgent conditions or urgent condition. Non-urgent condition are those patients who are transfusion dependent. For example, thalassemia, major disease, they are transfusion dependent. They receive a lot of transfusion um, monthly, weekly, depending upon the patient schedule. Or if they have any aplastic anemia, for example, their bone marrow is not making any blood, they are transfusion dependent. So each unit of blood contain almost 250 milligram of iron. So when you check their their iron level is high because of the repeated blood transfusion. So this is normal for them. And when it is about 1000 on multiple occasion, then the hematology team usually intervene and give them medication to reduce the iron content from the body. Second patient, which is a worry for all, if someone has very high ferritin count. Very high means 5,000, 10,000, 15,000, maybe more than that even. And the patient has high grade temperature, fever, and it is not responding to antibiotics. And the blood counts of the patient, hemoglobin, the white cell or the platelet counts, they are also falling down. So fever which is resistant to antibiotics, ferritin which is very high, Okay, and counts which are falling or falling counts. So it becomes 3F: fever, which is resistant, falling counts, which mean decreasing hemoglobin or platelet or white cell count, and the ferritin, high ferritin, very high ferritin. Then you will be thinking about that this maybe this is HLH. Then you should call the hematology and take their opinion. They would ask you to do HLH score in this patient, and they would do the bone marrow biopsy in the patient, and they may take over the patient from you as well. In HLH, the highest ferritin that I have seen up till now is 82,000 ferritin, but in non-hematological conditions like fever, like infection, inflammation, liver injury, their counts rarely exceed the ferritin level rarely exceed above 1,000. So whenever you have high ferritin, see whether this patient has any infection, inflammation, liver disease, alcohol intake history, kidney disease, or even marked obesity can lead to high ferritin as well. Because marked obesity, the patient with marked obesity may have other features as well, like hyperlipidemia, and then they constitute a syndrome which is called metabolic syndrome. So hypertension may be a part of the metabolic syndrome in a very obese patient with hyperlipidemia as well. But if this patient has a history of thalassemia, aplastic anemia, or any congenital anemia in which this patient is receiving a lot of the blood transfusion, this patient ferritin will be high because the blood unit contains a lot of iron, and as I mentioned, one blood bag contains 250 milligram of iron, so their ferritin will be high as well. Maybe the patient has a background diagnosis of hemochromatosis as well. That's why the ferritin is high. So looking at the background history of the patient is important. But if you have any patient with very high temperature and the accounts are falling, the accounts falling mean low hemoglobin, low platelet count, and the ferritin is very, very high, and they are not responding to antibiotics, then this completes the criteria of 3F. Then you should inform your hematology team whether this is HLH or not, because this patient is not responding to antibiotics. Ferritin is very, very high, and there is anemia or thrombocytopenia or low white cell count. We are worried that this may be HLH. Then yes, they will advise you accordingly. Thank you very much. This was a little talk about the high ferritin with non-hematological causes and hematological causes, and when to talk to hematology. Thank you.